Atrial fibrillation, or AFib, is an irregular heartbeat in the upper chambers of your heart in which the heart's electrical system doesn't work as it should. The U.S. Centers for Disease Control and Prevention estimate about 450,000 people are hospitalized with AFib each year, with about 158,000 deaths. September is AFib Awareness Month, and cardiologist and Dr. David Lamb from the Swedish Heart and Vascular Institute joins me now.
Thank you.
Thank you for being here. So for someone that hasn't heard of AFib, what is it?
Right, so atrial fibrillation, also known as AFib, is an irregular heart rhythm, or an arrhythmia. Could also be called an irregular heartbeat. And it comes in a lot of different types. So atrial fibrillation is the most common type of irregular heart rhythm. What happens normally in the heart, if you think of the heart as a top and bottom chamber, the top part says beat and the bottom says okay, and it just says, I'm going to beat and you're going to go next, I'm going to beat, you're going to go next. What happens with atrial fibrillation is the top part of the heart, if you will, it's on its own dance. It's on its own song, but the bottom part doesn't know that song. And so they're just going off rhythm. They're disorganized, it's irregular, and can get people into trouble.
I've never heard someone explain it that way, and that was so helpful. Thank you. And how do you distinguish if it's anxiety, that kind of feeling that maybe some people might get confused between AFib and anxiety? Does that ever happen?
Yeah, there's a lot of overlap between the two because the symptoms oftentimes can sometimes be anxiety related also. Atrial fibrillation usually is going to be more palpitations or irregular heart rhythms that go on, not just a couple seconds and then goes away. And usually, or sometimes people also get fatigue, feel run down from it, maybe chest discomfort, short of breath, getting winded with activities. Those are also some signs that it could be atrial fibrillation.
And what should you do, or what should a person do if they believe they are in fact experiencing these symptoms?
The best thing to do is we need to get a diagnosis. So we need to know, is it just stress related? Is it just too much caffeine that day? Or is it atrial fibrillation? And the only way to do that is to get an electrocardiogram or an EKG, ECG at your doctor's office. There are also now tools people can buy, different home devices, watches, different gadgets that people can buy to check their own rhythm. But generally speaking, I'd recommend seeking medical attention and seeing if it is atrial fibrillation or not.
And what are the complications if this is left untreated?
The most feared for atrial fibrillation would be stroke. So what happens is if there are irregular heartbeats and the blood's not circulating well, that can lead to blood clots forming in the heart. And if you have a blood clot in the heart, goes up to the brain, that could be a stroke. So that's one of the most serious complications. Another one is congestive heart failure, where if the heart's not beating right, it can lead people to develop swelling in the legs, which is a sign of congestive heart failure. So pretty serious complications that we want to make sure are treated.
And is there anything people can do right now with maybe some of their choices or lifestyle changes that would help their chances if they do have AFib?
There are a few things we can do. There are lifestyle changes, there are medications, and then there's procedures or surgeries. And we spend a lot of time talking to people about making healthy choices to reduce their risk of AFib. That includes keeping healthy weight. So if you are not a healthy weight, then working to exercise. We try to get people to exercise 30 minutes a day to keep their heart healthy, keep them on their feet. Reducing things like alcohol use, which has been shown to increase your risk of atrial fibrillation, and then also sleeping well. Sometimes sleep disorders, whether you're snoring or your bed partner says you're snoring or you're not breathing well at night, those can be also signs that something's going on.
And what has Providence Swedish done to advance care for AFib?
What we found for atrial fibrillation is that there's a lot of different spokes in that some people might go to their primary care doctor, they might go to the emergency room if it's off hours or overnight or on weekends. They might see a cardiologist, but there's not really a home for atrial fibrillation patients. So we set out to design a clinic that is to treat atrial fibrillation and to treat everything related to atrial fibrillation. That could be diabetes, that could be high blood pressure, sleep problems, and make sure the whole person is really taken care of. And so we have a comprehensive approach to care in our clinic, and I'm proud to represent that here today.
Absolutely. That sounds very comprehensive, and thank you so much for explaining all this in a way that I can understand, and I'm sure a lot of people appreciate it. So thank you.
Thank you.
And to learn more about detection and treatment of AFib, go to the website right there you see on your screen, swedish.org/AFib.
This portion of New Day Northwest is sponsored by Providence Swedish.